many people are experiencing depression and anxiety.
Yeah.
So what are the possible causes of all this, and what are the signs and symptoms of depression and anxiety?
They're very closely related, depression and anxiety, I have to say. But overall, the feel of depression is sort of a loss of vitality, a loss of energy. Whereas anxiety, because of the cortisol and the adrenaline being pumped up, you might feel like you're energized, but you can't keep at this pace for too long. And also, you're jittery. And so those are the two main differences. With depression, you feel out of control. Maybe a lack of control because you're so depleted. With anxiety, you might feel this need that you want to fight back because it's fight or flight response that's activated. But at the same time, because of all these chemicals running through your body, the tension in your muscles, maybe brain fog, inability to think well, you also feel out of control to meet the challenges coming at you. So, I mean, clinically, there are 9 signs that you look for before you decide a person is, if the person is clinically depressed, and there must be 5 of the signs that are present for a period of at least 2 weeks. And of the 5 signs, a depressed mood for most of the day for that 2 weeks, energy loss, a sense that you are to blame for what is happening, so a lot of recrimination, and various others as well. So I'd say check with your health provider to see whether you meet this criteria. Because again, depression is a scale. You might have mild depression, you might have serious depression.
Thank you. It's so interesting, right, to learn about anxiety and depression. Wow. And Clara, how about that? With Michelle mentioning about all these signs and symptoms, and if let's say employees are well supported by the employers during this challenging moment while they are coping with all the signs and symptoms listed by Michelle, do you think they'll be more likely to stay on?
Absolutely. I think the first step to having an employee stay on is really they must be understood and they must be, of course, appreciated. I think those are the main reasons why employees leave their jobs, right? The majority of people leave their jobs not just because of the money. Yes, they may have better offers outside, but there is also a push factor on why they want to leave the companies. And if they feel they have such a supportive environment, which is understanding and flexible, that caters to their needs, then I'm sure that will also help with employee retention. So if you don't mind, maybe I'll just add on to what Michelle was mentioning earlier. So one of the ventures that I've been investing in the past 2 years is a population health venture where it's science-based in the sense that we use a technology to basically identify the parameters for mental health. So for instance, when it comes to physical health, we have temperature and heart rate to determine how healthy we are. And when we are 37 degrees, thermometer says 37, that means your fever. What we have is, imagine a thermometer. It's exactly the same. We can actually measure someone's stress, anxiety, and depression levels. We give them a cut-off. So when you know that you have cut off, you've reached a certain threshold, that's when you need, we have a triage system. We can triage people to certain help. So for instance, when you reach a certain threshold, we say, probably you should go and see Michelle. Michelle actually can provide you with, some of these help, some of these services. And for individuals, the thing is, moods change throughout the day as well. For some of them, they are not so serious. They're perfectly healthy, but they may be a bit stressed. And the solution is as simple as, I think you need to go and step away from your computer, go and get a coffee, and then come back, and then to manage your mood. So that's essentially the technology that we have. It will only be launched in Q1, so I'll not announce the launch of this product yet. But the idea is we want to integrate this into people's lives without them thinking that it's actually a mental health solution I have to initiate. It will be integrated on all your devices that basically tells you when your thresholds hit a certain level. It's basically integrated into your whole lifestyle. Yeah. So that's the thing that we've been working on. In stealth mode.
That's amazing because what we are accustomed to is the fact that depression cannot be spotted through a brain scan. But here's a different way of looking at big data and using that data to help people recognize whether they have depression or anxiety.
I'm excited about that. Thank you so much. And the thing is, what is your advice for the employers who are not too sure on how to approach their employees?
I'll answer that from an employee perspective because we have an HR professional here. So from an employee perspective, I think a confident, a mentor who can have that one-on-one trusted relationship that gives me space to talk about what's troubling me, be it at the workplace or at home. So I think that's the first part.
Thank you. And Shauna, what's your advice for all those employers who are not too sure or hesitant to invest in mental health?
I think supporting employee well-being, in general, it can start from many ways, right? I think there are things such as the leave, the type of leave you offer to them, the type of benefits that you offer. These are things that are very hygiene, right? That you can provide to your employees. More than that is also the culture that the organization stands for. In terms of, is it a workplace that creates a supportive culture for the staff, right? And if we go down to staff themselves, I think I would say as a start, it's very important for supervisors to be tuned in, to the topic of mental health, right? So I think I met them through going for the Wellbeing First Responder course, in which some of my other colleagues went as well. So it's not just a HR thing, right? I think it's something that everybody can be a part of, right? Because it cannot just be if it's just one HR, HR cannot support everybody, right? So, it has to be everyone. And it's basically equipping people with the skills, right? To have active listening skills. What are the things that you look out for? Like maybe, you notice someone who's looking a bit more down than usual. And then you just have that very natural culture to say, hey, is everything okay? And then check in with them. Yeah, so I think, those are some of the things.
You mentioned about the culture. That's something I love very much. Let's create a culture where everybody, feels so comfortable talking about this, like a safe space, to speak out about the challenges, right? A safe space to seek help and talk about everything, all the sun and everything. So anyway, moving towards the closing. Time flies really fast. But before that, Michelle, I'd like to ask one question, which is like commonly posted at most of the workshops or mental health talks. That is, what is the difference between psychiatrists and psychologists?
Okay,
Yeah.
so a psychiatrist is actually a medical doctor, an MD. So he'll be able, or she will be able to prescribe medication. So the interventions might be mixed, right? Some form of talk therapy, some form of medication. A psychologist would be someone with a PhD or a PsyD, and they would deal primarily with behavioral interventions to do with an issue. So they wouldn't be able to prescribe medication.
I see. Thank you for your clarification. That's a very common question. And my last question to the three of you over here is that may I invite you to shout out to someone who has made a change or an impact in your work at your workplace previously. Anybody in your mind? Beginning with Shauna this time.
I think a few, actually. I mean, I won't name them, if not there'll be too many. But I think even personally, I know I can identify when, Clara talked about sometimes when you go through a lot of stress, or maybe you don't realize it. So I myself went through, a very stressful period. You just kind of go with the what's going, right? And these colleagues of mine, they actually reached out, and checked in, basically. So I think I'm very thankful to them. And they also, shared a lot of encouraging messages, to get me through that time. Yeah.
Thank you, Shauna. And next, Clement?
Yes, I want to shout out to my co-founder in Singapore Deep Tech Alliance, 𝗱𝗶𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀 And we've been through thick and thin. A lot of difficulties starting up companies, but a lot of happy moments as well. And we have had, of course, very stressful periods and, periods when we have to deal with. Actually, most of the time it's stressful. So yeah, I want to thank
as
him.
long as you're staying in Singapore, right?
So I want to thank him, for being there and for being understanding as well.
Thank you, Clara.
I love that you're ending with this. It's so nice because it brightens anybody's day to hear themselves being mentioned, right? So I'd like to say a big shout out and thank you to Maureen from HR at SPH. I've spoken to Maureen, and in difficult times, I find that Maureen always acts with compassion, and she is that safe space. So Maureen, thank you very much.
Thank you. Thank you so much. I'd like to shout out to my team as well, my board members, my team members, Thank you for walking this journey with me. It has never been easy, but thank you for being there. And everyone, I really enjoyed this conversation. I don't feel like ending it at all, but I'd love to have you all again. Thank you so much. And everyone, thank you for tuning in. And before closing, I'd like to share with you on Wellbeing Network. The Wellbeing Champion Network, and I'd like to invite you to read out about this initiative launched by the Workplace Safety and Health Council. Thank you so much. Take care.